I always had this agreement with my body that I would take care of my body and exercise and stay fit and eat the right things. And in exchange, my body would take care of me. And that's not exactly what happened. My name is Brad. I'm 50 years old. I live just south of Nashville, and I've been married for 24 years. We have 2 boys, one in college and one about to go. I stay active every single day: golf, fishing, baseball, football. I love spending time outside. I went and got my annual physical right before my 50th birthday. My doctor ordered a urinalysis along with my regular blood work. When I opened up the link for my urinalysis, that's when the story really began, and I realized something was wrong. So I have a friend that's a nephrologist, and I screenshotted part of the urinalysis and shared it with my friend, and he got right back to me, and he asked me, whose urinalysis is this? And I said, well, it's mine. And he goes, well, I need you to send me the whole thing along with your labs, and I'll call you later. He reviewed everything and told me he thought this was going to be something called IgA nephropathy, and that was the first time I'd ever heard those words together. Once I was diagnosed, I was devastated, wondering how could this happen? I've taken such good care of myself for so long, and for this to happen, I felt betrayed by my own body. This was just a whirlwind, because I went from thinking I was healthy as a horse to my nephrologist is concerned that I have something going on. From day one, I knew I had to be proactive. I knew that I had to protect my kidney function and that there was a risk of needing dialysis or even a transplant. So I started searching for podcasts about IgA nephropathy, and I found a leading expert on the disease, and I thought, I want to get a second opinion from her. IgAN is rare. It takes someone who really knows it, and finding a specialist was one of the best decisions I've ever made. During my second opinion visit, she reviewed my history and recommended TARPEYO. I had done a lot of research and was already familiar with this medicine. I was ready to get started based on her recommendation and experience with other patients. TARPEYO is an FDA-approved medicine used to reduce the loss of kidney function in adults with IgAN. TARPEYO was interesting to me because it's an oral 9-month course of treatment, and the capsules work to target a source of IgAN that's produced in a specific area of the gut. I knew it was important to have a treatment approach that targets both a cause of my kidney decline as well as the existing kidney damage. Once I decided on the right treatment approach for me, I braced myself for the insurance process, but the approval came through quickly after the enrollment form was submitted. The TARPEYO Touchpoints team made everything simple. My refills are now handled by text. They reach out every month, I confirm a few things, and they ship it. It's very easy, and I love that option. I told my physician I will be the most compliant patient that you've ever seen, because there's certain things that I can't control, but there are quite a few things that I can't control, and that's doing all the right things with, my strict diet, blood pressure control, and taking my TARPEYO capsules every morning about an hour before I eat breakfast. I feel great, and my labs are actually showing that the amount of protein that's in my urine is coming down, and my eGFR is actually improved over time, which validated everything that I've been doing, and that was very, very encouraging. Before I started taking TARPEYO, I used to crash every afternoon. Throughout my treatment journey, I felt more like myself. My personal experience is that once I started therapy with TARPEYO, I've had minimal side effects. It's just I take my pills in the morning and then I can forget about it till the next day. This has been my experience with TARPEYO, and everyone's is different. When I got this diagnosis, I felt every emotion you can imagine. And for me, staying on top of my own health and asking questions is making all the difference. I feel like my IgAN is in my hands with TARPEYO.
Important safety information. Do not take TARPEYO if you are allergic to budesonide or any of the ingredients in TARPEYO. See the end of the patient information for a complete list of ingredients in TARPEYO. Before taking TARPEYO, tell your healthcare provider about all of your medical conditions, including if you have liver problems, plan to have surgery, have chickenpox or measles, or have recently been near anyone with chickenpox or measles, have an infection, have high blood sugar levels, prediabetes or diabetes, have glaucoma or cataracts, have a family history of diabetes or glaucoma, have or have had tuberculosis, have high blood pressure, hypertension, have decreased bone mineral density, osteoporosis, have stomach ulcers, are pregnant or plan to become pregnant. TARPEYO may harm your unborn baby. Talk to your healthcare provider about the possible risk to your unborn baby if you take TARPEYO when you are pregnant. Are breastfeeding or plan to breastfeed? It is not known if TARPEYO passes into your breast milk or if it will affect your baby. Talk to your healthcare provider about the best way to feed your baby during treatment with TARPEYO. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. TARPEYO and other medicines may affect each other, causing side effects. How should I take TARPEYO? Take TARPEYO exactly as your healthcare provider tells you. Your healthcare provider will decide how long you should take TARPEYO. Do not stop taking TARPEYO without first talking with your healthcare provider. Take your prescribed dose of TARPEYO one time each day in the morning, at least 1 hour before a meal. Swallow TARPEYO capsules whole. Do not open, chew, crush, or break TARPEYO capsules before swallowing. If you miss a dose of TARPEYO, take your prescribed dose at your next scheduled time. Do not take 2 doses of TARPEYO at the same time. If you take too much TARPEYO, call your healthcare provider right away or go to the nearest hospital emergency room. What should I avoid while taking TARPEYO? Do not eat grapefruit or drink grapefruit juice during your treatment with TARPEYO. Eating grapefruit or drinking grapefruit juice can increase the level of TARPEYO in your blood. What are the possible side effects of TARPEYO? TARPEYO may cause serious side effects, including effects of having too much corticosteroid medicine in your blood, hypercorticism. Long-time use of TARPEYO can cause you to have signs and symptoms of too much cortisol, a stress hormone in your blood. Tell your healthcare provider if you have any of the following signs and symptoms of hypercorticism: acne, bruise easily, rounding of your face, moon face, ankle swelling, thicker or more hair on your body and face, a fatty pad or hump between your shoulders, buffalo hump, or pink or purple stretch marks on the skin of your abdomen, thighs, breasts, or arms. Adrenal suppression. When TARPEYO is taken for a long period of time, chronic use, adrenal suppression can happen. This is a condition in which the adrenal glands do not make enough steroid hormones. Symptoms of adrenal suppression include tiredness, weakness, nausea and vomiting, and low blood pressure. Tell your healthcare provider if you are under stress or have any symptoms of adrenal suppression during treatment with TARPEYO. Risk of immunosuppression. TARPEYO weakens your immune system. Taking medicines that weaken your immune system makes you more likely to get infections. Avoid contact with people who have contagious diseases, such as chickenpox or measles, during treatment with TARPEYO. Tell your healthcare provider right away if you come in contact with anyone who has chickenpox or measles. Consult your healthcare provider regarding appropriate vaccination scheduling. Tell your healthcare provider if you develop any symptom of infection during treatment with TARPEYO, including fever, feeling tired, chills, aches, pain, and nausea and vomiting. The most common side effects of TARPEYO include swelling of the lower legs, ankles, and feet, high blood pressure, muscle spasms, acne, headache, upper respiratory tract infection, swelling of the face, weight increase, indigestion, irritation or inflammation of the skin, joint pain, increased white blood cell count. These are not all the possible side effects of TARPEYO. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see full prescribing information.